Good evening to all. This 30-second research theme that we'll be discussing today is based on the article Pomero 2017. So, the idea of this research is to give us an insight on edema. So, as we know, edema simply refers to swelling. Swelling can occur due to various disease conditions. So, we have a classification. Edema being two types. One is unilateral as well as bilateral. So when you say unilateral, in one particular localized region, and maybe bilateral is where on both sides. So mainly we are referring to the feet, or like edema at the feet, on the feet. So if it's only on one side of the body or one foot, then it's unilateral. But if it's on both sides, it's bilateral. This can happen sort of suddenly, acute condition, or it can be a chronic, sort of a long term condition, like due to venous insufficiencies or even extrinsic compressions, right? Or due to some infections, or even reflex sympathetic disorders. But at the same time, bilateral means that can be, as I said, it can be in leg edema, as I said before. There also we can divide into acute and chronic, and chronic can have the same reasons mentioned earlier, but it can be a generalized edema as well on sort of both sides of the body, right side and the left side. So sometimes, as Pomero 2017 had highlighted, some of the drugs can also contribute to edema condition. So that is, for example, like certain hormones, drugs taken as hormones like estrogen, testosterone, even steroids for that matter of fact, and sometimes even cytokines due to maybe some immune deficiencies or some genetic, especially primary immune deficiencies where cytokine production is lesser. So we may intervene patients with interferons, IL-4, IL-2, even granulocyte, monocyte, colony stimulating factors. And in terms of cancer, uh, when chemotherapies are provided, like cyclophosphamide, cyclosporin, all those. And even during a viral infection, like antiviral drugs like acyclovir, or to reduce the hyperglycemic level, like antidiabetic drugs, rosiglitazole, pioglitazole, antidepressants, right? And even antihypertensive drugs to reduce the blood pressure. So, like beta blockers, calcium channel blockers, all these have proven to induce edema in certain individuals as a side effect or as a complication. So, this is an overall picture of what Pomero 2017 had suggested.